So sports hernia versus a groin strain. A lot of times it can last for a very long time on people if they don't have the right treatment plan involved. So I'll just do a quick discussion today about what these things possibly could be and ways you might be able to confirm a little bit more on yourself, or at least run down what you're experiencing. So I encourage you first to take the webbing of your hand and put it right on the side of your body and slide it all the way down there. Okay? You're going to butt up into a crest here, which is right around like here on this guy. And from here we can use our hands to kind of trace down a little further. So here, slide your finger down and you're going to butt up into a bony area there called the pubic bone or the pubic symphysis. So there's an area that crosses here, which is it's the inguinal ligament as well as some of the musculature and ligaments or tendons that come into the area as well. There's also skin, fascia, nerve, all that kind of stuff in the area as well. Now if we take the hand from the other side, we're going to go here, we're going to slide this thing back and you're going to butt up into a bony area here called the PSIS. Okay? The PSIS is a section of the it's of the SI joint. You're going to note it right there. It's pretty bony. I'll spin them so you can see. And sometimes on people who are thin, you can visualize this on them too. And so this whole area, the whole pelvis is actually very important, as well as the hip in regards to groin pain or groin strains, as well as sports hernias. And so the first thing I want to draw your attention to is locations. So now that we're oriented here, and we slide our fingers down here, and there's the pubic bone. Just above it and to the side, there's a fleshy area, which is still part of your abdominal area, which is a location for the common sports hernia diagnosis, also known as Gilmore's groin, athletic pubalgia, sportsman's hernia, so multiple different names for this. And this is the area here. To be clear, sports hernias are not hernias. They're fraying, they're tears, they're soft tissue obstruction or deformities that don't necessarily have the bowels come out towards you. If you have a hernia coming out, a lot of times that will be changed with digestion and so on, and you actually visually see it. A lot of times with sportsman's hernia, you won't actually see anything. You'll just feel it when you move and twist and walk. So the area is important, first off, just to give you a rough idea of what possibly could be driving that problem. What could be creating the pain inside the groin area. Now, generally speaking, we can use use a different model. I like models that you guys can see and I can move around up. So right here, there's the pubic bone. So we just noted this area right here on the side. Again, and it's still in the belly wall, and so that could be a sports hernia. It could also be lots of other things too, but that's just one common thing. Now, if we're talking about adductor strains, we're talking about more low, okay? It's coming off of this pubic bone and even lower into the leg. You guys probably know what the adductors are, and most of you can do, like we call this a Captain Morgan type of stretch or position, where you go like this, and all your adductors are exposed right here. And so if you trace them all the way up, and you get to that same bony area, that's still the pubic bone. This is now all of the adductor mass. There's a lot of adductors in there. And so a groin strain is typically a strain of the groin muscles which are coming up from the leg. So it's going to be more of your adductor longus, magnus, even pectineus, the small ones like that in there. Now, let's play devil's advocate a little bit here. Both of these are tissue disruptions, we call them, okay? So they should be grade 2 tears or above, which means that there should be some type of positive imaging finding. MRI, ultrasound, x-rays are worthless in this because all they see is bone really, and joint and alignment. But if there was really a tissue disruption that's significant enough to create some pain with you, then you'll probably have a positive image. Now, I'm not telling you to go out and get an image or get an ultrasound or an MRI done because, granted, these things are nice and extra information to have, but they're not needed to start care. And to be honest with you, many people dealing with groin pain, sports hernia type of pain, as well as groin strains, can dramatically improve over the course of a couple weeks. And we're starting to build something called capacity and strength. We're getting the hips to move better, which decreases the amount of insult to those tissues, because if we keep tearing the scab up, then it's not going to heal itself. We can also get the abdominal wall, the whole abdominal wall, the hoop system to work well, and we get something called ball socket dissociation within the hip. It's also probably far-fetched to you guys, but actually the shoulder is actually very important in regards to these tissues too, because they go, the fascia goes all the way from there, kind of like my shirt is pulling when I'm raising my arm, okay? And so images, great, fine. Extra information, great, but not needed. We have something called a working diagnosis most of the time, and this is how most clinicians will operate. We don't need to 100% know what's going on. We have to know what it's not and what the highest probability option is. So if you walk in and you have groin pain that goes down your leg some, more so when you're sitting like I am in this position, and I'm not necessarily twisting too much, I put this up like this or like this and it bothers me, there's a probability this is a hip impingement. If there's a deep click and click, pop, clunk in the hip, maybe it's a labral tear, which are possible reasons for groin pain too. Now, an adductor strain, it's probably going to be bruised, right? Because there's tissue disruption. If there's no bruise, probably not that. If there's a sports hernia, it will probably be because you have a mechanism of injury that works. Also groin strains too. Again, devil's advocate with this. I'm just bringing it up because there's a lot of misinformation about sports hernias and groin pain throughout the internet, and I just want to make sure that everybody has a good bearing, logical bearing of what you need to do or what could be happening to you. Now, I guess first, if you just want to know what's happening with you, you can certainly come to us. It's easier just to not think about it, have someone work with you professionally, and just have them establish a plan. You just do it and that's it. Feel free to contact us, info@p2sportscare.com, or links below. But if you want to understand, which I know me as a patient, I wanted to understand too, then you have to understand the logic of things, okay? You can't have a problem that doesn't have the mechanism, okay? If you came into my office and said, oh, I got a concussion, well, what'd you do? Nothing, I just woke up with it. You can't. It's just not gonna happen. It's a low probability diagnosis. Now, if you came in and said that you hit your head and you have a concussion, yeah. Or you got hit playing football, yeah, makes sense. Now, if you come in saying you have a groin strain or a sports hernia and you woke up with it, you're not really too physically active, you spent one day at the gym, you didn't go too hard, you maybe played a little bit of pickup softball, but you were just playing first base, you really weren't sprinting too much, you just hit the ball a couple times, that's not a mechanism for it, okay? The term that we have in medical for this condition, for sports hernia, is athletic pubalgia, athletic person's pubic pain. So if you're not the athletic person, you probably have something else going on, which is okay. It could be a low back disc, it could be referral from the mid-lumbar nerve roots, it could be hip impingement, it could be labral tears, it could be all those, which are fine. Those are really fine, and those too have their working diagnosis. We will know that we're on the right track when after the course of about 2 weeks, you feel dramatically better.